If you've been on some consultations, you may have heard these terms thrown around: open rhinoplasty, closed rhinoplasty. What does it mean exactly? Well, in medicine and in surgery, an open procedure essentially means you're making an incision in the skin and directly visualizing the tissues underneath. With a closed procedure, you're working without an open incision and you're kind of indirectly performing that surgery. How does this apply to a rhinoplasty? When an open rhinoplasty is performed, there's a tiny little incision made on this part of the nose, which we call the columella. After that incision is made, it's connected to two other incisions inside the nostrils, and all the skin off the nose is reflected up. With a closed rhinoplasty, we're making tiny little incisions inside the nose, no incision on the skin, and the procedures are performed that way. When do I choose one over the other? If I'm doing delicate tip work, or maybe it's a revision rhinoplasty or what we call a secondary rhinoplasty, I like to visualize those cartilages, especially of the lower third of the nose, directly, so I tend to do an open rhinoplasty. If I'm doing smaller procedures or issues that are related to the breathing or functioning of the nose, tend to do those closed. Advantages to the closed approach is there's less swelling, there's usually less pain, and there's no visible scarring on the nose. The open rhinoplasty procedure, there is a tiny little scar, and the lower third of the nose, or what we call the nasal tip, tends to be a little more swollen. Otherwise, at 6 months or a year out, the results are essentially the same. So I hope this answers your question. What is an open rhinoplasty versus a closed rhinoplasty?